Hey everyone, I want to show you how I use the OnForm app and slow motion video to perform a very thorough gait assessment on my runners. So in the clinic, what I'm going to do is obtain a video from the back, right? Getting the whole body, the feet up to the shoulders, two lateral views, so from the right and from the left. And a lot of times I'll use a tripod to make sure I'm at the same level in all these images or all these videos. And then from the front, I'm just going to get everything from the pelvis down to the feet. That's more just to look at knee position, right? So we got 4 videos total. Then what I'm gonna do, pull in these videos into OnForm and perform an assessment. So for the posterior view, I like to look at the amount of pronation my runners have, the amount of hip drop, knee separation, and then separation of the feet or the stance position. So let's start with assessing the amount of foot pronations going on. So here, right, runners normally have some pronation, right? Pronation is normal, but overpronation is not. In this case, she lands on the lateral foot on the left side and then pronates a normal amount into a neutral position. Same thing on the right. So first of all, I would say just visually looking at this, that she has perfect pronation of the feet. Not too concerned there. Looks like she's got enough strength, support, and stability of the ankle to manage her running patterns. Now, if we look at the hips, I want to find that mid-stance position, the amount of pelvic drop that's going on. So here, I'm going to do is draw an angle. I'm going to line it up with the seams of her short, and then line it up with horizontal. I'm using just like the grate in the back of the clinic there to make sure it's parallel, right? 6 degrees there. Anything above 7 degrees, I consider abnormal. We might want to look at hip stability. We might want to look at retraining single leg stance to make sure the hips aren't dropping too much. But in this case, she has no hip pain. She has solid hip stability, right? I'm not too concerned about 6 degrees. From there, we'll look at the other side. Same thing, we're gonna find that mid-stance position on the left side, right? So in peak loading response, right about there is where the right hip is dropped the most. We'll draw our angle here, and as parallel as we can to the ground. About 6 degrees there as well. Again, symmetrical, nothing crazy there. Now we can scroll and look through at knee position, right? She's not hitting her knees together. There's a little bit of space between them. I'm not too concerned about reduced stance width or knee positioning. And same thing, in the feet, there's no signs of crossover. I almost imagine there's a thin line that she's trying to land just outside of, right? If there was a thin line in the center of the treadmill, I'd want that most medial part of her heel to be landing on or just outside of that line. In this case, we look great. All right, so for this runner, in the posterior view, everything's looking golden. All right, here's the lateral view. This is the money shot because I can get a lot of data points from this position. If you're tight for time and you need to just do one position that you're gonna video from, this is the one to get, all right? Because we can see the ankle, we can see the knee, hip position, trunk position, all in one place in that sagittal view. All right, so first thing, if we start at the bottom, I wanna look at the foot inclination angle here. So that's looking at what is the position of that foot upon impact. So here, let's go forward a little bit. And you can see there's a little bit of daylight under that heel when she lands. So she's got a nice mid-foot impact, right? A more forefoot impact, the foot's gonna be much more inclined, right? The heel's gonna be much higher. Whereas a rear foot impact, right? There might be a little bit of inclination with the toes up on impact, or a significant rear foot where the toes are lifted quite a bit. Right? All these different inclination angles are fine, except for maybe one where you're significantly heavy rear foot impacting, right? Putting more stress up the chain. But, right, different positions of foot inclination are just gonna put stresses on different areas. This runner is a high level runner who has actually adjusted to more of a midfoot impact. History of stress fractures, she wanted to potentially minimize that risk. So she went ahead and got more of a midfoot impact. And in this case, it looks super smooth for her. Right, so we're gonna call this a midfoot impact. Next, we're going to look at tibial inclination angle. So, upon impact, what is the position of that tibia in? Right, so right around here, this tibia is actually almost straight up, right? You can kind of tell, right? If you put a 90-degree angle, and we put that right over the tibia, all right, it looks pretty straight up, right? So those stressors are pretty minimized on the heel, on the knee, on the hip, because she's working like a very effective pendulum in this case. Whereas if someone's landing with that foot a little bit more in front of them, a lot of times what happens is that tibial angle becomes more inclined this direction, and that's going to create more of a braking force, potentially put more stress on the front side of the shin, right, causing shin splints if someone's landing with a heavy rear foot impact. If we're inclined that way, right, that could put the risk up. I don't often see people inclined significantly this way, right? Maybe if you're significantly leaned forward, maybe in sprinters we'll see that, faster running, but for the most part, we want that nice straight up tibia, just like so. The next assessment we want to do from the sagittal view here is ankle dorsiflexion. So here, this one's a little trickier to see, but upon impact, through mid stance, right, the heel should start to lift right when that foot's coming underneath her, right? Right when that knee starts to pass the toe, we should get some rear foot lift, which that's what we're seeing there. It's coming up. You can see that shadow increasing as the toe goes under the knee. Now, what can happen in some cases is someone's foot stays, we call dorsiflex, right? Dorsiflex, 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 and that rear foot stays down. That's going to be or indicate a lot of strain on the Achilles tendon. As someone's foot is staying glued throughout the stride and they're not having a nice springy mechanism to that Achilles, that could mean they're trying to minimize stress on the Achilles, or their Achilles is weak, and in this case could put them at a risk of an Achilles tendinopathy or some kind of strain in the calf. But in her case, right when that toe goes under her knee, we start to see some more shadowing, and she's efficiently striding through. So this looks great. Next, we're going to look at peak knee flexion. All right, so for this one, we want to be at mid stance, which is when the thighs pass each other right around here. And we're going to use our angle tool. We're going to line it up with the femur, right about there, and the tibia. So in this case, the angle's right around 39 degrees. Ideally, I want to see between 35 and 45 degrees, and I want to see symmetrical knee flexion. A lot of times in our post-op ACL patients, say it's 4 or 5 months post-op, we're getting on the treadmill, we're seeing how the running looks, they're going to look pretty stiff-legged, right? We're going to see 25, maybe 30 degrees of knee flexion, whereas the other side is nicely getting to 40, 45 degrees. That's indicating they're avoiding using their quad, or their quad is weak, or they're avoiding too much knee flexion due to some kind of stressor at the knee or some kind of injury. And therefore, right, we got to work on that load capacity, that quad strength, to allow them to more efficiently flex their knee, right? So a lot of times there may be some asymmetry side to side, but for the most part, if someone's healthy, we should see 35 to 45 degrees of knee flexion on both sides. Next, we're going to look at peak hip extension. So what we need to do is find the terminal stance to pre-swing position right about here, and we want to draw an angle with one arm being through the femur, the center being at the greater trochanter, and the top arm being an imaginary line bisecting between the ASIS and PSIS, right? So that's why it's important to tuck in the pants. But I'd say right over here is our angles, and that's right at 5 degrees. Anything around 5 degrees I find to be pretty ideal. We don't need more than that. Whereas anything significantly lacking, where we're getting excessive lumbar lordosis and they're not getting a lot of extension of the hip, right? We may be concerned about excessive compression at the low back because of that repeat lordosis and potential tightness in the anterior hip structures, all right? So really good thing to look at here. We want to look at symmetry on both sides for this. Finally, from the sagittal view, we're going to look at trunk lean. So for this measurement, we can find mid stance, but honestly, trunk lean doesn't change very much throughout gait. So just to standardize it, we'll look at mid stance, but it really doesn't matter too much. And what we have to do is create our angle. One arm is going to be an imaginary arm vertical to gravity. All right. One is going to be in the greater trochanter. And finally, we're going to put one arm right over the anterior chromion here. We get an angle of about 4 degrees. Ideally, I want to see between 5 and 12 degrees for runners. So she's a little bit more upright. Right? You can actually tell that she looks pretty upright. And in this case, if you're too upright, you're going to have less glute activation, and it's going to be more quad heavy. Right? So in runners who have any patellofemoral type pain or patellar tendinopathies, it's really important to look at that inclination angle of the trunk to see if they're too upright. And in this case, maybe she might benefit from being in a slightly increased forward trunk lean just by a degree or two. And this might take a few sessions of practice to get this to be kind of a habit, but right, just a slight anterior lean can take a lot of stress off the knee and shift it north towards the hip, where those glutes can handle a little bit more compressive load. All right, that's it for the lateral view. All right, so from the anterior view, we can look at that position of that knee. And this is where I can really pick up on any significant knee valgus. You might be able to pick up on foot pronation, but I like that better from the posterior side or from the back. So here, right side, minimal. If you look at her actual positioning. Through her foot here. Right, maybe 5 or so degrees, 6 degrees of valgus here. But I really don't see much wiggling of that knee as she goes through stance. Same thing, right? If I see that knee turn in significantly and rapidly, sure, I worry more about stress on the patellofemoral joint, on the tendons that attach to the greater trochanter, knee, medial meniscus, those kind of structures. But in this case, she looks great.